Good night. You got it? Good afternoon, everybody. We are waiting to get a quorum. So that is why we have not started. You can tell that we're getting toward crossover day, and there are lots of committees going on where people are on those committees. I think I'm getting like the speaker. Sometimes he says that if people don't come to committee meetings, they shouldn't be on committees anymore. There are 35 people on this committee. I'm trying to get 11. Yes, I do, and I really appreciate it. And I know that Representative Sebald, he doesn't get to vote because he's not on the committee, but he's very interested. So we let him sit with us. So I'll put in a word for you on the next go around.
I'll show up.
Okay. It's just that time. Crossover is the 28th day. We're on 22. You can go ahead and turn your cell phones off if you want to. Which reminds me, I wonder if mine's off. Where is it? Is Representative Henderson here? Okay. Okay, we now have a quorum, and I will officially call this meeting of the House Health and Human Services Committee to be in session. Representative Henderson, you have a small bill and you have like a short period of time to talk about it. You can either sit here or you can go up to the podium. And this is Representative Henderson's first bill. Everybody be nice to her, but you can still ask her important questions. Okay, go ahead.
Thank you, Madam Chair Cooper. I am Representative Sharon Henderson, and I stand before you today to introduce Bill HB 937. So Health and Human Services Committee, I stand before you. This bill is very passionate to me. This bill has a personal value to me because I was diagnosed with a rare beginning stage of breast cancer 4 months ago. And I say rare because doctors at Cancer Treatment Center of America had not seen it in 28 years. They said that it was just at the beginning stage to form and had not spread into other tissues of my body. So it was because of timing of my mammogram and early detection. After only 3 months of treatment, I was able to ring the bell cancer-free. Thank you. Thank God there is a bill that passed in 2019. However, my bill number 937 will require language to be added where we will require insurance companies to send written notice to women upon reaching age 40 to have an annual mammogram, because early detection saved lives. Early detection saved my life. At Cancer Treatment Center of America, my daily connection with women, I asked many women, have you had your mammogram? The responses were hard to believe. I haven't had one in 3, 5, 10 years. Some said that I never had a mammogram. I am introducing this bill to hopefully rectify that problem. I met a young lady, Shelley, was a young woman at Cancer Treatment Center of America. She was only 43 years old, and she did not have a mammogram at age 40. She discovered that she had already been a stage 3 with breast cancer that had spread from her breast to her liver, to her kidney, and to her rectum. She was in a wheelchair with a colostomy bag. And she said, "Ms. Henderson, I heard you ring the bell, and I wish that was me. I did not have my mammogram at age 40. And that's what this bill does. Therefore, Health and Human Services, I thank you for this time. I have with me my dear husband here with moral support. Thank you, honey. And also Ray Williams from Cancer Treatment Center of America. He's a VP for Government Relations. And today, Health and Human Services Committee, I ask for your favorable consideration, or if you have any questions.
Questions for the presenter? We have, I've got one. So you think that most women do not know that they need to have a mammogram?
Yes, ma'am. And I was really surprised. It's really absurd, and I was really astonished. Since my experience with cancer, I've ran into women. It's like I'm on a mission now to tell every woman I know, go and get your mammogram, because it saved my life. And I found out that a lot of women don't even realize that their insurance company covers it free. They don't realize that, you know, at age 40, you can start getting a mammogram. Like I said before, 3, 5, 10 years, they've never had a mammogram, some said. Yes, ma'am, Chair.
Is there anybody in the audience? There any other questions from the? Oh, y'all quiet. Everybody that has a bill after this better hope there is quiet and don't ask as many questions. Is there anybody in the audience that wants to speak briefly to the bill? No? No one against it? No one for it? Okay, we got it. Okay, what is the pleasure of the committee? Okay, we got a motion to do pass and second. Is there any other further discussion about the bill? Seeing none, everyone in favor of the passage of the substitute to House Bill 937, which is LC 33905-9S, say aye.
Aye.
Anyone opposed, say no. Okay, the ayes have it. Okay,
Thank you so
very
much.
much.
Thank God.
okay. Is Representative Gambrell here? Okay. Okay, get this one out of the order. Okay. And you are bringing, give us the bill, it's bill number, House Bill 1279.
857. And so, first of all, thank you for the opportunity to present today. I appreciate being here. And I'm just going to give you a little bit of the background of this bill and why I'm even here talking about this. Back in the summertime, I was approached by one of my assistant magistrate court judges in Bartow County, who happens to be over the age of 65, and he's a Vietnam veteran. He's a good friend of mine, and he said that currently he was not legally able to travel with his medications in a 7-day dispenser. And I don't even know the professional term for that. Correct. And so he asked me, like many of y'all have constituents, to do something about it. And so that is where this bill came from. And basically what it would allow there in section 1 there towards the line 20 is anyone over the age of 65 who has been prescribed 3 or more medications by a licensed physician can do so, and in one of these containers. And so that's in a nutshell what the bill would allow. I have spoken with the Pharmacy Association, and they have suggested one change that I think might be mentioned at some point, and I'm certainly amenable to that, but I'm happy to answer any questions that you might have about this bill.
What change there? What are they suggesting? Oh, yeah, I just want to know about it before you ask questions in case somebody's going to ask that question.
Okay, online, let me see, 22, change the 7-day to 21 days. Believe it or not, those of us over 65 sometimes go on a 2 or 3 week vacation. Not just 7 days.
I have 3 kids. I'm lucky to get out of the house 2 days. So
Well,
Yeah.
yeah, I did that too.
yeah, yeah,
I'm on the other side.
I understand.
So
Okay, wait, we'll get it. Betsy.
Thank you, Madam Chair. I had a question about line 20. For over 65 who have been prescribed 3 or more medication, what if they only have insulin?
Well, and I'm assuming, would that be in the pill form?
Just what if they
Just-
only have one medication? Like, why is it 3?
Right. Well, I would imagine that with the dispenser, if you're taking multiple pills, you're putting those in for each day. And so if it's under that amount, it might be a little bit easier to keep up with them and track. So this would benefit, individuals that probably own a lot of medications and are carrying those at the same time.
So would it be a problem to change that to 1? I mean, does it have to be a number? Because I have one of those little things and they're filled with vitamins. I take 8 vitamins a day. But if I only had one medication, then this wouldn't fall under, not over 65.
So, I'm not opposed to that by any means. I mean, that would certainly clarify that it didn't have to be more than 3 items, but that would just be up to the will of this committee. And
Representative Gambrell, I think that why you need this to begin with is that when you put them in this dispenser, then they are not identified.
correct.
And, if you're going through security or something, somebody might question what they are. So even if it's just one. So Representative Hutchinson, are you suggesting 1 or more?
Yes.
Okay. But if, depending on the author of the bill, if he has no objections, we'll get that. I've got another question. Representative Bennett.
Chair, and thank you, Representative. Just to support Representative Hutchison's question, I take medicine, and because I get 3 months supply, I can. If I've got one container, it certainly is more compact. If I could put them all in the 7, 14-day, 21-day, or whatever day container.
Right.
So, Madam Chair, I understand the nature of needing to identify the medication, and that's fine, but the number could be problematic.
Sure.
Committee. See, no questions from the committee. Do I have anybody in the audience that wants to speak to the bill? Okay, all right. Okay, what's our position? What would the? All right, you're got a motion to do pass and second. All right, at this point, I will entertain possible amendments to it.
I move the amendment, line 22, strike 7-day and or more, just holding a 21-day supply.
That's going to preclude somebody from carrying just a 7-day supply.
Right. So 7-day or more means you could do 21 days.
Well,
No,
that's true. I think people were concerned about you going with 40 or 50 or whatever. Listen, I'm fine. I mean, you can leave as is. I was just listening to other folks.
You could say 7 to 21 days supply if you wanted to.
All right. We'll
Okay.
just leave it as is then.
no, wait a minute. She's suggesting you can. How are you suggesting it, Betsy?
Saying holding a 7-day to 21-day supply.
A 7-day to a 21-day
Okay,
supply? Is
That's
that
fine. Yeah, you like that better?
like that one? Okay. All right.
So it means you have to take 7. You
So
have
it's a
6,
7 to a
you decide.
21-day supply. That it, Betsy? Okay. Everybody in favor of the amendment? Huh? Oh, Brian, you've got a question? Sorry.
Yes, ma'am. Thank you, Madam Chair. Now, Betsy, does that Does that means if somebody had a 7-day supply, they leave the house, but they only got 5 of them in the container, then they're actually breaking the law.
Well, it actually goes to the container, so it's in a container.
I mean, if we're saying that number means a difference, that means less than, you better have all 7 with you every single moment of the day, or else it's illegal, right? I know that's the point, but that's. It-
I know Representative Gambrell, did you talk to people about this before you brought this bill?
Well, I talked to a few folks, but obviously
You
not
must be the
enough.
wrong folks. You're gonna
Yeah, the
come back.
old people. Uh-huh.
All right, Betsy, is there a solution? Wait. Okay, okay.
There we go.
Up to a 21-day supply? No. Okay, thank you.
All right, so now the amendment that it would read, holding up to a 21-day supply. Sharp, do you need to talk about that possible amendment?
All right, that's it on there where you talk about the medication container with a capacity of holding. I think the verbiage could be more like that, Betsy, because I mean, you may not have all the medicines in there. It's all about the container. So with the capacity of holding, you get what I'm saying? So that's what the language needs to be.
Is that, now, wait a minute, Sharper.
Go ahead.
I respect your job, but
Oh,
you're
no.
not our lawyer.
Oh, that's fine.
You don't want to be Ed Setzler, do you?
No.
Pretends to play that he's a lawyer.
Hey, I've been working with Betsy on the side. No, I'm just kidding.
With all due respect, Ed Setzler, who likes to pretend he's a lawyer.
Mhm.
Okay, Betsy, you tell us how you would like for it to read.
I mean, I think that's a good idea, that you go to the container rather than the medicine that takes it off the table. So compartmentalized medication container capacity to hold up to a 21-day supply.
Exactly.
Okay. Ooh, you're in trouble. Don't come back with another bill like this.
Yes.
Okay, but we're going to correct it for you. Okay,
Because this one little thing, Chairwoman,
yeah.
that if you focus on the container, a lot of people, even though they want to be able to have the container in case something happens, a lot of those people still have all their medicines, their bags of medicines with chronic diseases with them, just in case they leave somewhere and they end up in the hospital or they have to go somewhere else.
Right.
So they will have that with them. So we need to focus more on the container itself.
Gotcha.
So that's why.
Thank you.
Representative
No.
Sharper, I was just giving you a hard time,
Oh, no
as I
problem.
like to.
Oh, you're good. I didn't know you saw me over here.
Because you're
So
nice and you'll let me. Okay, all right. Betsy, can you read out how you would like that amendment? And let's see if we can get it passed.
Sure. So on line 22, would say compartmentalized medication. Up to a 21-day supply.
Did everybody hear that? Okay. Then everybody in the favor of the amendment as offered by Representative Hawkins? Say aye. Anyone opposed? No? Okay, all right, we got that amendment. What was the other one? Representative Hutchinson, don't make it that complicated.
It's, should be really, really simple. I move that we amend on line 20 where it says who have been prescribed 3 or more, just change the 3 to 1.
Okay, so on line 20, at the end, it would be, have been prescribed 1 or more medications instead of 3 or more. Does everybody understand the amendment? Okay, everyone in favor of the amendment as presented by Representative Hutchins, say aye.
Aye.
Opposed? No? Okay, the ayes have it. Betsy, you got it? Okay, now to the bill. Is there any more discussion about it? Don't anybody offer anything. We don't want to make Representative Gambrell too anxious about it anyway.
Right.
So, pardon, no, he doesn't have any more. We can't tease him anymore.
No.
Okay, no discussion. Okay, everyone in the favor of the passage of House Bill 1279 as amended, and will be a substitute, as amended, LC 338857, say aye.
Aye.
Opposed? All right, the ayes have it. You've got it.
Thank
Don't you
you.
tell Danae that I gave you a hard time.
I will not. She loves you.
Okay, welcome. You're welcome back anytime. Okay, Representative Williamson. It's all right. Just called you. Are you coming by yourself? I didn't think you were going to come by yourself.
No, ma'am.
I mean, Representative Williamson thinks that we'd be a hard committee in here. I just thought we were just always nice and easy.
Thank you, Madam Chairman, members of the committee. I'm here today to bring you House Bill 1069 by committee substitute LC 339054S. This bill is meant to address a sort of a gap in our licensing, current licensing for mental health care facilities. This act on line 21 of the committee substitute said the act would be known as the Adult Residential Mental Health Servicing Licensing Act. Currently, these adult mental health care treatment facilities are licensed as personal care homes. And as most of us know, personal care homes are typically aimed at those in the latter stages of life that either have mobility issues or cognitive issues that are needing a little bit of help in the later years of life. And unlike the 250 or whatever personal care homes in the state of Georgia, these adult psychiatric residential treatment facilities, the rules and regulations for these personal care homes don't exactly marry up to the rules that need to be in place to offer the best practices of care to the people needing psychiatric services. For example, in a personal care home, the operators can't limit the mail you get, the packages you order, your visitors, or your food, all of which are pretty important when it comes to helping people through their mental health issues. And so with that being said, I'd like to introduce, for those of you who don't know, Stan Jones is an attorney that helped draft this legislation. Beth Finnerty is the president and CEO of Skyland Trail, which is an adult psychiatric residential treatment facility located in Atlanta. And they have an outstanding record of helping principally young adults get through their diagnosis and treatment for mental health issues. And Dr. Ray Kotwicki, I apologize. Kotwicki is he's a medical doctor, especially in psychiatry, and he's the director of medical services for the facility. So at the chair's pleasure, I thought maybe Mr. Jones could walk us through what the bill's doing. And I do want to point out that this is a bipartisan piece of legislation. It was I'm the #1 signer on it, and thank you, Chairman Cooper, for being the #2 signer on this legislation for the committee's edification. I know we're looking to committee substitute right now, but Whip Hatchett, Majority Caucus Whip, is the #3 signer. Chairman Mary Margaret Oliver signed the bill, as well as Chairman Butch Parrish. Everyone other than myself has a pretty healthy understanding of how healthcare services work in the state of Georgia. And I want to preface all these remarks by saying that I dropped this bill 1 month ago tomorrow, and I've had nobody come by my office. Nobody's contacted me that had any problems with this bill, objections to the bill. And until today, I was stopped on the floor walking over to see the national championship trophy, and somebody said they had a problem with the bill. So I have had the pleasure of meeting with some people at the Department of Community Health. They have been in contact back and forth with Stan as we attempted to basically work this bill in a manner that best meets the needs of and protection and safety of the patients that can receive these services to great benefit. So, Madam Chair, if that's all right with you, I'd love for Stan to walk us through the bill.
Okay, and it's my understanding, we're having a hearing only because there does need to be amendment to it. But representatives from DCH think they have found a way to resolve this with an amendment. And there just wasn't time to get it written and done before today. We have a meeting tomorrow, which is very important. We will have the mental health bill, everybody. Please be here on time. It's 11 till 2. We will be voting that bill out. So I need to have you here. If they could get it, that amendment, which may not be possible by tomorrow, we can come back after the discussion today and pass it out. If not, it'll be on the agenda for next Tuesday. We're working Betsy to death, so she might not have time to make that amendment before tomorrow. So we'll see how it goes. Okay, Stan.
Ladies and gentlemen of the committee, thank you for your attention. I'm Stan Jones with Nelson Mullins Law Firm, a healthcare lawyer, lobbyist. I also had my kid at Skyland Trail many years ago. So there are several members of the body as well as others in the audience who are familiar with sort of longer term residential care for adults starting at age 18. This is a gap in licensure that we have multiple types of licensure. Some are covered by certificate of need, some are not. The adult residential personal care home licensing is not covered by certificate of need, and it's not intended to raise that issue in this bill. I shudder to mention the words, but we're trying to sort of provide a mental health license. Beth can describe why that's important. It has therapeutic reasons to be important, as Representative Williamson described, and it also has some insurance issues too that are relevant for reimbursement questions. This bill was modeled after the Drug Abuse Treatment and Education Program. And the key parts are really in the on page 3 at the top of the page, where we try to define what an adult residential mental health treatment program is and what it's not. It is a step down in the continuum of services from outpatient to acute care, psychiatric care, and then to longer term residential care to help people learn how to live in recovery. So this is defined for people over age 18. You'll see in line 40. It's in a residential setting of 4 or more beds. We picked the 4 because there's some smaller personal care homes that are used particularly by DBHDD for patients in the mental health system. And it's for facilities that are not licensed as a hospital. So that's an important distinction. Hospitals have their own type of accreditation as hospital facilities. These types of programs are accredited as behavioral health programs, which is a step down unit for longer lengths of stay. The department has raised some other questions to us about additional ways to refine the licensure so it doesn't cover too much or too little. I don't mean this to be opaque at all, but the rest of the bill is mostly about picking up the language from the Drug Abuse Treatment and Education licensure that has to do with empowering the department to pass regulations, to do inspections, to take into account accreditation as a continuation of licensure, to have appropriate background checks for the leadership, as much as is true in nursing homes, drug abuse treatment centers, and medication treatment. And there are some additional standards that are particular to this type of facility that are start on line 80 on page 4 and 5. So this is a list of the types of criteria that DCH would establish and use from other licensing schemes that enable this type of program to have more therapeutic control over things like nutrition, as Representative Williamson mentioned, visitation and some things like that can become a problem. So I'll stop there. I'm happy to go as long as answer as many questions as people have later today or tomorrow too, before we come back with the proposed DCH amendments. Thank you.
Thank you, Madam Chair, and I appreciate the bill author for bringing this and those who are advocating as well. I guess just my one question, Stan, is on line 66 where we define mentally ill person. Is that
Uh-huh.
kind of how we're defining mentally ill across the code just in general right now? Or how did y'all kind of come to that reference as part of the definition?
So this is actually a discussion also in the big mental health bill. There are several definitions of mental illness and substance abuse in the code. So this one is a reference to the Diagnostic Statistical Manual, the most recent one that has the largest number of diagnoses available to the treating psychiatrist to submit a claim for coverage. There are in the mental health code, there is a narrower definition and I don't know for sure what's going to be done with that in the next couple of days in the bigger bill. But this is also referenced in some of the licensing individual licensing statutes like psychiatry and psychology, for example, where the licensed professionals are permitted to at least argue to the payers that this is a legitimate mental illness diagnosis, and then the payers make decisions on medical necessity for that. So this is broader. This is the broadest one in the sort of market right now, and it's the newest one. So the diagnostic manual changed, I think in 2020.
Because this could be all the way, I mean, this could still change now between July 1. I mean, we're in March of, March,
Well,
March 1st or 2nd today, March 1st.
That's
So I mean,
true.
could it change between now and July 1 of 2022?
This one will not change.
Okay.
As Betsy has taught me over many years, the reference to an external body or piece of information needs to be updated periodically as that changes. So the most frequent example in the session is the Internal Revenue Code. The Georgia provisions of the Revenue Code are updated every year to conform to changes in federal law. So if this changed again, if the diagnostic category changed again, we would have to come back and update that.
Okay, thank you.
Does
I was
that
just
seem
curious about that and how it would fit in with the overall bigger mental health bill as well.
So this is the same one as in the big mental health bill currently.
Okay, thank you, Stan. I appreciate it.
Representative Hutchinson.
So everybody knows my issues with mental health regulation. Certainly, these places are not just operating willy-nilly right now. So what is this going to replace? I mean, I know that they have to have something already. They have to have, I don't know if they have to have DTAP, CARF.
So.
You asking how are they licensed now?
Yes.
So programs like Skyline Trail are currently licensed as personal care homes. And the issue is complicated by the fact that like outpatient programs in the office of a psychiatrist or psychologist or other mental health therapists are only licensed by the individual licensure category. So those facilities don't actually have any licensure other than the professional license for the treating person. But Beth may want to address why the personal care home license hasn't fit very well for the more sophisticated residential adult program.
I would like to hear that.
Yeah, we have been operating under a personal care home license for 33 years. So we opened our doors May 1 of 1989. And at the time, that was really the only licensure that was even close to being appropriate for us. And we have dealt with it through different waivers. I mean, our patient population has gotten more complex over time, and personal care home regs, as Representative Williamson indicated, is really more for nursing homes and assisted living facilities. I'm going to let Dr. Kotwicki talk a little bit about some of the clinical problems, but I do recently, we have run up against insurance companies not approving payments for services at Skyline Trail. We are Joint Commission accredited, which, as you guys probably know, is really the good housekeeping seal of approval in the healthcare industry. We've been accredited since 1995, in addition to that personal care home license. And just last year, as we went for TRICARE certification, they said, we're not going to accept a personal care home license. It does not fit. Recently, Cigna has said the same thing. And so that really prompted us, after living with this for 33 years, to say we've contemplated this for many years prior to this. It's not an inexpensive process to go through this. And so we felt like it was really time to do this now as we grew. But I think there's also some clinical concerns that, Ray, you might want to talk about.
Yeah, thanks for your question, Representative Hutchinson. I would love to underscore some of the clinical implications that really don't match the patient population we're serving. Skyland Trail and my job is really to make sure that we're evidence-based, we're measurement-driven, and we incorporate the most recent advancements in psychiatry into what is available for our patients. So just a couple of examples. If we're working with a patient who has a dual diagnosis, which is both a mental illness with a substance misuse problem, and they're early in their recovery, and they would like to have their drug dealer visit, which is not a good idea and is not evidence-based, we do not have the authority to prevent that visitation. If there's a patient who is having a decompensation and they have psychosis and they're hearing voices that other people can't hear, or they're in a manic episode and they request a medication to help control those symptoms, our personal care home license does not allow for us to administer medications in the residence. So we have to bring that patient out of the residence over to a medical clinic, a primary care clinic, and give them their medications there. And so it's many examples of not being able to provide what we know is effective treatment in a situation that is designated as a personal care home. We've moved and evolved beyond that.
Right. So you would not have to get the personal care license anymore. This would replace it. Okay.
Correct.
And I didn't think y'all accepted insurance.
Yeah, we do.
I've referred people to you. The last person I referred. Yes.
Representative Hood.
Thank you. I have a couple of questions. One is, how many licensed beds are at Skyland Trail? And the second question is, do you know how many residential treatment facilities like yours exist in the state today with a personal care home license?
How many residential mental health treatment facilities?
Yes.
I mean, there are hundreds of personal care home licenses in the state of Georgia that deal more with assisted living and nursing homes. I would say I could probably count on one hand how many would fit into this licensure category. And I'm looking at Stan. Would you suggest?
I think there are about 5 right now. Of course, there could be others.
And in terms of personal care beds that are licensed, we have a 24-bed adult facility, a 32-bed adult facility that are staffed, voluntary licensed facilities, and we have a 28-bed independent living facility that's in an adaptive reuse of an apartment complex. We also have an adolescent program, which is a totally different animal. It's under a different sort of licensure altogether. And
Okay. Yeah, I was just curious how many other programs of your kind exist, and say that again.
About 270 personal care homes licensed today. So they range from small homes, where primarily elderly patients are taken care of, to the large assisted living facilities. We've been through the list, and we know of 4 or 5 of those that are focused on mental health treatment rather than memory care or support for the elderly.
Right. Yeah, I'm very familiar with personal care homes and assisted living. I was just curious how many other treatment facilities are like yours that are using the personal care home license. I'm aware of other mental health and substance abuse programs. I'm thinking of one close to me, like Turning Point Hospital. What makes you different than that type of program?
Then Turning Point?
Right.
Turning Point's an addiction treatment facility. So we're primary psychiatric. So all of our patients that come in have a primary diagnosis of major depression, bipolar disorder, schizophrenia, anxiety. Some of our patients have a secondary substance misuse disorder they're not actively using. We are also a voluntary unlocked facility, which is kind of a real important distinction between an outpatient center and an inpatient psychiatric institution. In fact, over 75% of the patients we receive are referred to us from an inpatient institution like Peachford or Ridgeview or Emory or Anchor, et cetera, et cetera. And just to let you know, I'm thinking about other places that might benefit from this. Community Friendship is here in Atlanta. That's a another, I'm not sure they're licensed as a personal care home, but the cottages, there's something called Southern Live Oak Wellness. Those are three that may benefit from
Okay.
this.
And I've heard good things about your program,
Thank
and I appreciate y'all being here.
Thank you.
Can you tell us anything about your success rate of people who go through the program?
Yeah, I appreciate the question. We have a really robust research and outcomes program. And we do what's called a paired sample pre-test, post-test model to see how patients improve both from a symptom control perspective, but from an overall functionality perspective. So we measure things like ability to function independently, how people can develop social relationships with others, as far as to existential things, whether or not somebody feels like they can change the course of their life moving forward. And in literally all of those areas, we have both a statistical and clinical significant improvement between the first measurement and the time the same instrument is used and a second measurement is obtained at discharge. And so just as an example, when we work with patients who have treatment-resistant depression, which is about 70% of all of our adult patients, out of that group, 75% of everybody who goes through our program reaches remission. And that means that they're just like anybody who doesn't have depression. Not that they've had an improvement, but they literally are without depression when they leave Skyland Trail. So we are publishing nationally. I think that we're a pretty well kept secret in town in some ways from a research perspective, but we want to share our story, not for self-serving purposes really, but to help other people produce as good of results as we see.
Representative LaHood, it sounded like you were interviewing to see if you needed to go there. And I wondered if session had gotten so bad so quickly that maybe they have multiple beds for some of us to go and visit. Sounds like a great place and with good results.
Yeah, I wouldn't mind doing a trial stay. You might,
Yeah, like that,
might could do me some good.
Like that. Representative Kelly.
Thank you, Madam Chair. I was just thinking as we get closer and closer to session, we all may need a little help to get through. As I've just read through at another question or two, on line 142, we reference that a voluntary accreditation body can be the one who certifies these facilities for one or more requirements. And I guess that can mean all the requirements for the department to issue a license or a provisional license. What would that voluntary accreditation body be? And is there one in existence today?
Yeah, that would be the Joint Commission on the Accreditation of Healthcare Organizations. Its nickname is JCAHO, and it's been around forever. And we've been Joint Commission accredited since 1995. And that really is a very high level of accreditation. And CARF is the second one, the Commission on the Accreditation of Rehabilitation Facilities. So we are Joint Commission accredited. We have to go through this voluntary accreditation every 3 years. It's a surprise visit. This is a year for us to go through accreditation, and there's about 30,000 standards they go through and spend a week at our facility looking at everything from governance to facilities to clinical care to safety.
And that kind of leads to the second question I had, which was on line 178. Where it talks about the department shall conduct periodic on-site inspections. Do the JCAHO inspections come as a supplement to the department? And how often typically does the department do that? And maybe a question for the department would be, how often do they consider periodic? I guess would be maybe a question for the department, Madam Chair.
So they come out annually to do their inspection from the Department of Community Health in terms of the personal care home regs. And I would imagine this would be an annual inspection for this licensure as well.
Okay,
And I
thank
don't
you
think it's really,
as well.
yeah.
Okay, thank you.
Representative Fry.
Thank you, Madam Chair. I just had a general question, and it might be for the department. We had a situation in Athens where we had an unlicensed treatment facility operating. And we were told that they didn't have authority over an unlicensed treatment facility because they only have authority over the licensed treatment facilities. And so interestingly, that brings up a loophole in this legislation where there would be no authority if someone didn't want to get licensed. And it says you have to be licensed, but they can't enter the premises to look at the records. They can only go through a court and request that the records get sent to them, but then that can be delayed over and over time. So I thought that was a very interesting question to bring up. And this is the first time there's been another licensure that would fall into that same category, to where it says in the bill that they can enter in and inspect, but guess what? If they're not licensed, they can't do anything. And so maybe the department, or maybe somebody can answer a question like, how can we get a handle on that, to where if there are unlicensed facilities operating, Department of Community Health needs the authority to be able to shut them down.
I agree.
Joe?
Thank you, Madam Chair. My name is Joe Hood. I'm a senior advisor at the Georgia Department of Community Health. So specifically to your question, the department's role is regulatory. So it's to issue and regulate licensed categories. So we don't have a criminal enforcement arm, and that's not our role presently under the statute. So my understanding is when you have an unlicensed facility that's operating in any manner, that's going to fall to law enforcement. Now, we do have a role to go out and make a determination as to an unlicensed, which I think you're familiar with, which we try and do through court order, and then in conjunction with law enforcement if necessary. And more recently with GBI, where they have personnel to do that. And we're working towards, and we passed in a past legislative session, where we are working with GBI to train law enforcement and others so they can make their own determination upon a call out to address the very issues that you're discussing. I think that's progressing well. Not quite there yet. COVID certainly slowed us down a bit from the times we've talked about that in the past.
Joe, do we need, when we make the other amendment to this bill, do you feel like that we need to put in a provision like we finally have gotten around to on unlicensed personal care homes, where if you are without a license, it's basically a felony?
Right. I'd leave that to the discretion of the committee, of course, but what the penalty would be if you are operating without a license and met the criteria that's outlined in the application. That's similar to what's on, personal care home, for example, today has a similar feature.
Right. Okay. Well, could I ask those that are here in support of the bill, and Joe, will you think about it, since
Yes,
we have to
ma'am.
make an amendment anyway? Okay. I take it you are in favor of the bill if it goes forth, so we can work out the amendments.
That's correct. We met with the sponsor this morning, as he indicated, and we have some issues that we'd like to try and address to narrow the scope so we could have successful implementation at the department. We think we can work with the sponsor and get through those. I think there are a number of different places. There's probably 3 or 4 that we want to work on to accomplish that. It's very much in concert with what the testimony is from Skyland Trail, though, to narrow to that focus. So I've worked with some subject matter experts, and I think we can work with them on language and get back to you directly.
Okay. That agreeable with the authors and the people of the bill? And y'all can look at, if you want to put in a provision that says what happens. Thank you.
Thank you, ma'am.
Okay. Representative Hutchins, do you have another one?
I just wanted to make a comment.
Okay.
Thank you.
Short.
Very short. With my experience with mental health, if I needed a hospital bed, it would be Skyland Trail. I just want to let you know. Y'all do some great work, and I'm excited about your research arm. For kids, it will be Hillside, but for adults, Skyland Trail for me.
And I certainly agree. And I think there are several members of the General Assembly that their families have had to use, and Skyland Trail. They may not talk about it, but I haven't heard anybody that had a adverse reaction if they've had a young person there. So thank you for the work you do. Like to clone you and be able to have several more across our state. We need the beds.
So the CON lawyer needs to say this is not a hospital.
Yeah.
So,
Oh, it's just those old hospitals. You know how it is.
what normally happens, somebody sees a psychiatrist or the primary care physician first. they try to
Wait,
look for
just
problems.
hush, Dan. Anna Adams, would you like to stand up and say whether you are in favor of this or not in favor of this, please, and tell us who you're with?
Thank you. Good afternoon. Anna Adams with the Georgia Hospital Association. We are looking forward to continuing this conversation. There are a lot of really great actors in the state, Skyline Trail being some of them. And so we want to make sure that this bill doesn't have unintended consequences of letting the bad actors into the state or to be able to move further into the state, because as you know, those bad actors make everybody look bad. So we recognize there's a gap right now between pediatric facilities that are offering these services and then the ability for adult centers to offer these services. We want to help fix that. Also would like to just ensure that the data collection in House Bill 1013 doesn't conflict with the consent measures that are in this bill. So very much looking forward to continuing the conversation and keeping patient safety.
And
a
you're
top
not in
priority.
direct opposition to the bill.
No, we are not.
Thank you.
Yes, ma'am.
I just thought I'd bring that out since she has told me that ahead of time.
We are very supportive of what you're doing.
Okay. Can I ask just ask you if you're just in favor of the bill, saving time, just pop up in your seat and tell us. Beth Finity? Oh, that's all of y'all. So, okay, I take it you're in favor of the bill. Okay. So that only leaves John Bozeman.
Madam Chair, thank you. John Bozeman, represent UHS Hospitals, which includes Turning Point and Moultrie, Peachford, Summit Ridge, number of hospitals across the state of Georgia. First of all, I want to say hello to my friend Beth. My daughter was served in her facility and they did a fantastic job. She knows how much I think about their facility. I also want to apologize to the author, as I have been working with Beth and Stan through this process very diligently with our authors. I've not talked to the author of this bill as we were trying to work through a number of provisions. And I feel like we've come a long way on this bill. I did see the bill last night. Our lawyers are looking at it. To echo Anna's points, we agree with her holistically that we just want to make sure the good actors like Skyline get to do business, expand. We want to make sure that there are some bad actors out here that don't use this as a loophole. I feel like we're close to this, but I just want to continue that conversation. Thank them for the conversation and hope they'll let us continue to work forward to make this a good product in the end.
I'll continue to work, and it sounds like there's enough that we'll take it back up next Tuesday. And I mean, so you have till then to perfect it. Okay, Representative Jasters, House Bill, you're welcome.
Committee.
And you saw we don't bite, Representative Williamson. I can't hear me. Do you hear me, Representative Williamson? You figured out we don't bite in this committee. All right. Yeah. Okay, so. Huh? Pardon? Wait a minute. Hush, hush, hush. What? You seem to be biting. You've been biting today, only in a nice way. Okay. Yeah. Representative Jaspers, we have House Bill 1042.
Thank you, Madam Chairman. Let's sit right here if it's okay with you. Thank you, Chairman and committee. Before I get started, I just want to thank Ms. Lynn. I mean, we had a little switch we had to do early this afternoon, and I appreciate your staff, Madam Chairman, very efficient in getting it done. I just wanted to say that. Madam Chairman, myself along with you have been part of the Rural Development Council since its inception. And as the Rural Development Council has met around the state, we know they're underserved, or more importantly, not served areas of our state in primary care, meaning zero primary care, zero OBGYN, zero dentists, and just like we talked about it, and zero mental health providers in some of these areas. This committee, Health, fortunate to be a member for quite a long time, has put forth many ideas over the years to improve rural health care, and we thank you. House Bill 1042 is another tool in the toolbox for a community to improve their healthcare opportunities. I don't have to tell this committee about the absence of healthcare and what it means to healthcare outcomes for Georgians. What this bill simply does is allow the One Georgia Authority to provide a grant of up to $200,000 to a local development authority that has endorsed, I say bought into the idea of providing a primary medical care facility to a provider in their community. Of course, in this bill, there's a lot of writing defining what and wherefore, that the application should have and all that good stuff. An example I want to give you is an empty building the local development authority can buy, update, and lease with an option to buy for a provider or group of providers even on a 10-year lease, and then they own the building for a buyback at the end. You know, these medical providers are not only a healthcare improver, but an economic development dream for a small community in our state. That's the connection to the local development authority. Madam Chair, I did simplify the talk. You know, the technical parts are within it. And committee, I'll be glad to answer any questions best I can.
For the representative. No questions? Oh, good. Okay. Anybody in the audience would like to speak to the bill? Okay. All right. What's the pleasure of the committee? We have moved to pass. Second. Okay. No one's come up with a question? All right.
Thank you.
Good. Thank you very much.
Well,
And-
that's why I got just the mic just a second. Madam Chairman and I have talked about this for 4 years, maybe, in different ideas. We're glad we're getting this done.
Right. I mean, a lot of these cities have an empty storefront or building that would make a great medical office. And I can tell you, having been married to a physician, if you have an office set up for you and ready to go, it can be quite an enticement to get somebody, and with the rest that goes with it, to come to your community. And, you know, even if they didn't stay forever, the office is still there. People know where to go, and you can get another physician to take the place. So I am really glad to see this one
Thank you.
moving. I'm proud to serve on the rural
Development Council.
Rural Development Council. I
Yes,
only
ma'am.
wish we could travel on better roads. I'm on my third windshield.
Ooh, to the
I'm traveling the
transportation
back
chairman.
roads of
Woo.
Georgia. So, but I can tell you, we live in a great state, and there are a lot of really nice people all over the state in small towns. So it's an interesting thing. Okay, so everyone in favor of the passage of House Bill 1042, say aye. Anyone opposed? No. Okay, the ayes have it. Thank you, Representative Jaspers.
Thank you, ma'am.
Okay. All right. I guess I don't see Senator Robinson. Have I missed his? I don't. Are they still in, still working? Okay, I'm going to turn the podium over to Katie, Representative Denster, and Micah. You want to join me up at the podium? And I'll be right there. Okay. This next up is my bill, House Bill 1453. I'm gonna start and then you can- You ready?
Yes, please.
Okay, thank you very much to the committee. We've got some new members, but for the old one, I think you probably should be shocked that I'm sitting here talking about marijuana. I had real concerns through the whole process about marijuana. I often voted no. However, once the General Assembly decided in 2019 that this is the way they were going to go, and it became law, then my objective has always been to make sure that that we produce a safe product for Georgians to take if they are on the marijuana registry. That bill passed in 2019, and not one patient has been helped by that legislation in the last 3 years. In fact, several of the adults and children, I'm getting chill bumps, especially about the children, that we used to see here that came with their parents to lobby for medical marijuana have passed away in those 3 years. uh, the bureaucracy that prevented the production licenses from being awarded has failed those patients and their families. So 1453, House Bill 1453 will help break down this bureaucracy, and it's going to treat medical cannabis as medicine. We're saying it's a medicine. So that's one of the reasons, if not the most, that this bill moves it from public health, the oversight and all, to the medical board. If we're saying it's a medicine, it's a medicine. And we need to produce medicine on the standard that we would ask of any other medicine that patients around Georgia are going to consume. And so by moving this, it will ensure access to treatment that is safe and overseen by physicians. And as always, my number one goal is a safer and healthier Georgia. And that's why, I've agreed to carry this bill. We'll tell you it was funny. Micah and I went up to the speaker to tell him we were bringing the bill. He said, what can I do? And I said, well, I'm here as a nurse in case you faint. And then Micah told him, and I'm not sure he almost didn't faint, that because it's so unusual, because of my objection to it for so long before the General Assembly passed the bill in 2019. I'm going to let Micah go through the bill, and I can add as he says things. If you have questions too, we'll be here to add.
Thank you, Chairman Cooper. And I think it is a testament. God works in mysterious ways, and never thought I'd be sitting here with Chairman Cooper. That's for sure. But I'm proud to be, and look forward to working on this measure with her. Many of you know, she stated that it has been 3 years. We've got patients in this state that are waiting for medicine, both young and old. We have families, caregivers that are still without the ability to purchase a safe lab-tested medical marijuana oil, a topical rub, a tincture, anything that that our law said they could here in Georgia. And the diagnoses haven't gone away. The sicknesses haven't gone away. The need for medicine hasn't gone away. And we haven't done anything. Many of you know that the commission that was developed, created, and made 6 awards in July of 2021 announced those awards. And they also, and according to the words of the chairman of that commission, Dr. Chris Edwards, he said at that hearing that he would encourage the legislature to look into adding an additional 3 to 4 possible licenses. And I also want to make this clarification. If you'll remember in the original House Bill 326, I believe it was 324, 326, that we passed 10 licenses that year. And so what our bill seeks to do, in addition to moving the registry from DPH into the Georgia Medical Composite Board, due to the fact that there were, after the awards were announced, there were 16 protests filed, which is not uncommon. We knew that there would be these protests. Other states that have endeavored to take upon this type of policy measure have endured those same types of protests. Other states have put a few licenses on the market to deal with that. Other states have shut down for sometimes the same amount of time that we have. But we believe a reasonable solution would be able to go ahead and expand the amount of licenses by 6, which would give us a total of 12. We also believe that in doing so, our hope is that the courts would look favorably upon a good faith effort to ensure fairness, to ensure that we were doing everything possible. Some questions may be asked about how the licenses were graded. It may not have been my way of how it would have been done. Nonetheless, it was done. There were awards issued. There were 6 awards issued, and there were 16 protests filed. What our biggest hope and goal is, and if I had the solution in front of you, I would present it to the governor tomorrow, is whatever immediate measure we could do to get the 6 that were awarded up and running, producing oil, so that patients in this state would have access to a safe lab-tested medicine. This bill also recommends the commission to include, if you'll go to line 83, no later than August 1st of 2020, Oversight Committee shall recommend to the commission a process and plan for providing accredited lab testing products produced by licenses and for labeling such products. The commission shall consider recommendations for the Oversight Committee in adopting policies, procedures, and regulations regarding such testing, labeling, including accreditation of laboratories. Yes, you may, Madam Chair.
Okay. But the main thing, the first six that were the first six in the hierarchy that had been, we were supposed to award the licenses to grow would be able to, as of July, their license would be given to them to start production. So we would, pardon? July the 21st, that they would have their license to begin production by that date. So it would not be carried on for a year to wait more or anything like that, but at least the first six that were to be awarded the production license, as before it was, there were protests, they would begin to be able to work in July.
And as I wrap this up, I do want to take a note because for many years, I mean, I'm leaving the legislature this year. This started the second term of my freshman, or the second session of my freshman term. It kind of gives you an idea for the last 7-8 years.
I won a few of those battles.
Yeah, you did. And ultimately, we find ourselves sitting here today. And I think great thanks and appreciation to Representative Alan Peake. I mean, from the beginning, he always wanted the inclusion of the Medical Association of Georgia. He wanted the doctors at the forefront, at the table. I think it's a very wise move to have the registry moved over to the Georgia Medical Composite Board, because that board has the authority and the ability to sanction physicians. I believe having physicians involved in the point of sale, tracking the information, being able to speak with patients about this provision in our state is what we've always wanted. And so the Medical Association is here. Dr. DeGraffeny, who heads up the Medical Association Medical Cannabis Working Group within MAG, I think is a true testament to how far we've come in this state. But yet it's time to get this train to its destination. These families need it. Some here in this room, people across this state. I still have constituents from day one. Their need has not gone away. So I'm very proud of the bill. I'm also very proud of the fact that we have worked in concert with the government affairs team at the Medical Association, with some of their doctors. They're very excited in being able to have a seat at the table, to be able to put their hands around this and to be able to orchestrate facilitating the medicine that these constituents and patients in our state need. Thank you, Madam Chair.
I want to add, there were concerned by many members of the legislature about moving too fast. Not once we passed the law to let 6 people produce, cannabis of a medical grade in the state, but of opening it up to too many growers at one time. And so what this does is the first 6 would be able to start production in July. We have about 20,000 people that have a medical card on the registry card at present. When that number reached 70,000, then there are 6 on the, secondary list. The first person, the first group on that secondary list would then be allowed to start production. Then when it got to be 120,000 people with a 50,000 increment, then the next one would be able to produce. So it is a gradual, as the need arises and people, get the cards, then that's when more growers are able to grow and produce. It's so that we do not have an flooding of the market or anything, but we'll have where it meets the needs of our constituents.
Are there any questions from the committee? Chairman Jaspers.
Yeah, thank you. Thank you, Madam Chairman. My just question is the one that circles this whole issue is the 16 who were, who complained or protested, their threat of lawsuits to just really stop the process, from what I understand. Certainly not an attorney. And so how will this even that out so that we can move on? Just like we've talked about, we all want to see this thing move on. Will this be what it takes to move this thing along? I don't know how would I ask it, because they could sue us, I guess, or what, but that's my question, is I want to see it move.
Well, I don't think there's any way to stop anybody for suing for anything that they want to sue about. But I don't think that in a way that we should reward, in essence, what I call bad behavior. You don't get what you want, so you sue. And, when does this happen next on something they don't like about a bill that we passed? I know of another one right now that's in the court system, and one group that, doesn't like it. So it's been the courts it's been a year and a half or something not about medical marijuana. What it does is the commission had awarded the 6 already, and they had done their work, and they said the next 6 best ones that met all of the requirements, and they listed those. So right away, they would be in the line to be able to produce.
Sure.
Like that. So it gets the process moving. It sets up a system for, as the need across our state for people who are asking for cards to be able to use medical marijuana, increases, that there is a way to start meeting that need at that time, instead of all of a sudden flooding the state when there really there aren't enough people signed up for medical marijuana to use it.
Right.
But
Yes, ma'am.
anybody can sue.
Yes, ma'am.
And here again, we originally said, the bill said 10. The Senate
Right.
cut it to 6. So in essence, sort of doing it the way our is a sort of compromise.
Yes, ma'am.
With a
Thank
12.
you.
Chairman Jasper, I think, my fear is, and listen, I commend and applaud anyone who's brought any measure to the forefront to move this forward. I really do. I mean, that to me is a testament to the posture of the legislature. I know the House in trying to find a solution. I happen to believe this is the best solution. My fear is what happens in the state when the state puts out a competitive bid on anything, on any subject or any request. Do we set precedent by, if someone in those awards don't get it, or we bid to 4 people, 4 awards, and there were 6 or 7 that didn't get considered or didn't make the process, are they just going to file a lawsuit with precedent set? Well, in 2022, you went ahead and just issued the contracts or the awards to these individuals. Why can't you do it in this particular incidence? So that's one of my fears. Another fear is by issuing more than 6, or by giving anyone who protested an award or a license, do you devalue the original 6 and then give calls to those original awardees to bring a lawsuit? And then, so the process, continues. Are we limiting exposure? Are we trying to limit exposure in this particular instance for our best path forward to end up getting medicine to people that need it?
Thanks.
Representative Kelly.
Thank you, Madam Chair. I guess my biggest, concern with this whole thing has been the fact that it has been the 3 years, and nothing has substantially been done to get this oil into the patient's hands. I think we all share that frustration, and all it takes for me to support this measure is for you to tell me this helps get this oil into these children's hands.
Thank you.
I mean, once again, the first 6 would be able to have their license to start producing in July of this year. We are in March. So that's March, April, May, June, July. 5 months, less than 5 months.
Are there any other comments at this time from the committee who is present or online? Not seeing. Greg Raduca, if you would please present at the podium.
Thank you, Madam Chair. My name is Dr. Greg Raduca, and I'm with Let's Get Clear Georgia. We are a substance abuse prevention collaborative, about 500 persons around the state, many of whom are prevention professionals. And my background is, my doctorate is in human development from the Institute for Child Study, the University of Maryland. I've been involved with adolescent chemical dependence treatment, helped establish the chemical dependence program at Ridgeview Institute when it first opened. So the care of children has been a lifelong interest of mine. The members of Let's Get Clear have a great deal of compassion. We're people, we're nonprofit people for the most part. I have tremendous respect for Madam Chair. She is an expert in substance abuse prevention, one of the best in the building here. So thank you so much for the efforts you have made to understand substance abuse prevention and to recognize it as a professional field. Also with Representative Gravely, I know the concern that he's had for the past 7 years to help the children. It's a very heartfelt concern of hers, excuse me, and I really applaud Representative Gravely's efforts very, very much for what he is trying to do. I come from somewhat of a different world than maybe everybody else here in that I've been involved with substance abuse treatment. So I just want to say, as one person representing many, the other side, so that it's a balanced approach. I think there are many, many good things in the bill. I think honoring the RFP process was good. I understand, maybe I'm wrong, that the RFP process was approved by the Department of Administrative Services. The Q approach, I think, is a very good one to take. The ratio approach, looking at the number of patients that involve looking at supply and demand ratios, also good. There are some things, again, for the sake of balance, that I would like the committee to consider. I know you may not believe me, but I've really done the research. I can show you the labs that have verified this, can show you professional pharmacists, clinical pharmacists at UGA that have verified this, that 4 drops of THC oil at 5% contain 10 milligrams approximately of THC. And while I know that it is medicine for many, many, and I've experienced those individuals at hearings over the last 6 years, and so I know it helps many individuals, but also I think it's wonderful if we could keep in mind that 4 drops contains 10 milligrams of THC, which is a standardized serving of an edible in Colorado or Washington. They labeled them as such because 10 milligrams of THC is the point at which a new user begins to get high. And so people were having car accidents and other problems when they would overdo it with edibles. So 4 drops is that kind of dose. So for 14 of the 16 conditions, there are no age limits. So we've heard testimony over the years that some parents are giving their babies, their toddlers, THC oil because it's not dosed by the FDA. There's not a standardized dosage that's been worked out by the FDA. Parents could conceivably be overdosing their children or their babies or their toddlers. So if the committee might consider age minimums for some of these, because right now it's at 0 for 14 of the 16 conditions, I think that would also be a help to the children. If you might also consider, and I think the Oversight Committee has been talking about this, warning labels. I think warning labels are just so very, very important because it can affect things like pregnancy with stillbirth, low birth weight, neonatal birth syndrome. And so I think it's very important. Right now, I think warning labels are covered by just recommendations from the Oversight Committee to the Commission. I think if it could be put into law by you all about warning labels, let's get clear. Would be happy to supply you with some information of what other states have put into their laws regarding warning labels. I would love to be able to provide that to you.
Thank you. Are there any questions or comments for the presenter? Not seeing any. Thank you so much, Dr. Raduca. Next, Dale Jackson. Sure. So that would be Dr. Kelly. Oh, okay. I got, no, that's great. That's great. Yeah, that's great. Just introduce yourself to the committee so everybody's sure. They should know.
Thank you, Madam Chair. My name is Chuck Clay. I am a practicing lawyer, have been for 40 plus years. I got a legal education because I went to the University of Georgia Law School. So, we're on the right track. But I did want to take a minute or two, and I'm not in a court of law. Sometimes I want to say, may it please the court, may it please the chair and the distinguished members of this committee. I don't come here opposed to, in fact, I hadn't come to testify, but I do want to mention something when we talk about legal process and legal procedure and where we are, whether we like it or not by choice, not by ill will, not by incompetence, but because we've waded into a new and very difficult, very convoluted, learning as you go, we pass legislation, and how often do we have to come back and take a look? So I want to take a snapshot in time. The reality, it's about patience. How do we get it there? How do we get it fasted? What's the quality? What's the labeling? What are those things that truly matter and can save people's lives and at a minimum make them so much better in terms of quality of life? But the law is the law, whether we like it or not. And I don't want to go too far out of here because my distinguished jurist and country cousin, Judge Stevens here will probably correct me. But when we first got to law school, we heard terms like due process, equal protection, appellate process, appellate procedure. And those are the rules of engagement in courts of law. We're not in a court of law, nor are you a court of law, nor should you be. And this is not about threats or not threats. We've not threatened litigation. Depending on what might occur, I represent Pure Peach Therapeutics, one of the losers. Do I have a vested interest? Absolutely. But I'm also going to tell you the law. And one, I want to applaud both of these folks that they're both home folks I've known for more decades than I care to admit, and have been warriors in so many causes that are right and good, and they are not on the wrong path now. But in terms of why we have the challenge, and I think Representative Jasper, somebody up there maybe asked earlier, where are we? Well, when the bill was passed, you all put in the provisos, you put in the structure, you put in the rules of engagement of how this process was to go forward, right? You're going to judge all these prospective licensees, 60 plus, well over 100,000 pages. It would like be handing me the plans to Plant Vogel and saying, Chuck, tell me if they're doing good, or do we need to get another reactor company in here to do it better? Well, I'd look at the pictures and say, well, this one looks prettier. I wouldn't know. But we created a process where you created a commission wisely. You assigned and appointed the governor with acceptance of the approval of you guys, Andrew Turnage, fine man, and a competent and capable administrator. What we didn't do at the time and place, we tasked him, 8 lay people put together as a commission, physicians, great folks, others, community leaders, businessmen and women, to be sort of the arbiter of looking more, in my view, of trying to, certainly ultimately they pick and choose. But what we didn't do is give poor director Andrew Turnage any money. What we didn't do is provide any true technical expertise. If any of you all have looked at any of these proposals, it does look like in many cases you're looking at a planning to go to the moon. It is complicated, complex, highly technical information. And at the time and place, and again, it's not ill will or Jay, we often go this, but without the staff and facility to do anything or expertise or consultants, 8 lay people or a commission was asked to take over 100,000 pages of documents, break it into sessions, grade them, and hand them back. They did what they're supposed to do. Not critical of that. I applaud them for the effort. And I'm not saying they were all wrong. I don't know. But in that process, after that selection was made in this bill, it said we do have a appeals protest process. You have to take your protest to the commission and it will be judged, and we will make findings of fact, and we will make judgments on each protest. And then whatever the outcome might be, you can choose your legal team, your business, your entity to go forward. At the same time, somebody mentioned the DOAS. Were they asked, did we adopt the DOAS as a procedure and process that handles hundreds of millions of bids on an ongoing basis each and every year? No, we did not. And there was a reason for that. Did we assign the Administrative Procedures Act and judges and structure that handles these things on a daily basis to serve in any capacity for both the process and advise too? No, we did not. And I'm saying we because I'm included in that. I didn't have any better insight than anybody else. And so what we come to, and in the bill, for the best of reasons, we do a very general protection for trade information, trade secrets, proprietary equipment that is always and valid. But there's a way to deal with that in a court of law. You exchange information, and you can disagree and move the judge to put depositions or information under seal. And you do not violate that. And that is done every day in law offices and courthouses around this state, literally thousands over a year. So what happened here? Short of manpower, they asked to then, one, in there, we had a broad opinion of trade secrets. So basically, we don't have any information for anybody else. We have raw numbers, and that's it. In a court of law, and this is not a court of law, but I'm going to draw some comparisons, that would be accepted for just about 5 seconds till the judge says, you give the information, you're facing sanctions. Now come back and tell me what you're going to do. You can do it under seal. So again, it's not the same, but there are processes. But ultimately, because of lack of staff, then the commission asked, of course he has to, if asked, the executive director to be the judge of the process of which he oversaw in terms of the protest. And this is not a criticism of Mr. Turnage, but what I'm telling you is I used to be an assistant district attorney, and it'd be like me trying a case and get a conviction. Oh, by the way, I'm going to be the Court of Appeals in the Supreme Court. I don't even think that would pass due process, Judge, would it? But I don't ask you to make an opinion. But the fact of the matter is that is an absolute kind of black letter conflict of interest. So we're now in a place where we are where we are. The protest process, by the way, a protest process, and I'm going to say this because much of this, not necessarily us, maybe us, winds up in court. But the process itself is fundamentally flawed, but it's where we are. You take your facts as you got them. So what do we do? What can we do better? Well, I'll tell you again, if you go to court and somebody files and somebody will and ask for a restraining order, due process is not a silly word that we throw around when we don't like an outcome on a legislative bill. It is a term that means, was there due, fair, and procedural process? one of the black letter law for all you non-lawyers. If you don't file your appeal, if you do not perfect the record, you lose. And I've taken that all the way to the Georgia Supreme Court, and I got a very, very distinguished and well thought out decision. It was called one word: denied. I don't put that in my book of flattery, but it's serious. It is serious. So when we say, well, let's take the next 6 scores or whatever, I don't know, but if you don't file your appeal and you don't find a timely appeal, if you don't, as you well know, put your objections on the record, they're gone, they're waived. I don't have sympathy if you didn't follow the process that was in your bill to file appeal and protest. So where does that leave us? The real issue is how, and they've addressed this, how do we best circumvent the morass in some respects that we're in? You have heartbroken parents, you got kids that are suffering, and you'll hear that, and I know you already have, and I know you care. How do we get out of it? Well, we say we don't want to buckle into lawyers. I don't really either, and I think I are one. But it's not a question of threats. It's a question of where we are. And so you've got a process that was being judged by laypersons. You had no expertise, advice, or staff to bring in consultants. You have a protest process where no discovery has been exchanged. You've got an appellate process, a protest process is overseen by the very officer who made the decisions to award the licenses. And let me tell you something, I'll never judge what any judge is going to do in court.
Mr. Clay, we have a question for you. If you
Oh,
could wait
I'm
just a
sorry.
minute. That's okay.
I thought you just tell me shut up and go away.
Well, no, I'm not. I'm
Oh,
not
yeah.
going to do that. Representative Sharper.
All right, thank you so much for being here, and
Yes, sir.
we appreciate all the efforts and everything's going on. But I'm trying to kind of see exactly where you're going, because some of the stuff that you're saying is repetitiveness. So if
Sure.
you want to give us information that's going to help us be a part of what we're doing,
I am.
kind of get us to where we can understand where you're kind of going. I mean, the
Yeah,
whole process of what's going on, but if we just get to the point, kind of, instead of just the repetitiveness,
Yeah,
going
I
back
can tell you
over
what the
it.
point is.
Yeah, I meant to be honest.
Yeah,
I
no,
mean,
I'll tell you what the point is. I was pointing out the parallel because one is going to wind up in the other circuit, in the other courthouse. They go far across the street. And when they file a lawsuit, any of these protesters in a court of law, they've got a pretty good record. I'll never say what a judge is going to do, but I can tell you a Superior Court judge sitting there who sees this kind of process, it's not necessarily likely, but it's not unlikely either. You put a TRO, you stop that process, and then somebody with deep, deep pockets files a lawsuit, you're going to have 2.5, 3 years out there if you take it all the way up to the Supreme Court. So you got the lay process, you're going to be over it in the legal process. How do you end it? Well, one way you end it, and it's self-serving, is you take those protesters and say you have a license. State of Florida did exactly that. Exactly that. On similar appeals, some of it race-based, some of it due process-based. They granted 18 licenses after 3 years of litigation. So my point is, don't confuse. There is a process for both. One is going to lead you to the other, to a courtroom. And the rules of engagement over there are rigid. You all not bound by such, but what I'm telling you is if we want best to try to end it, I think me personally would be to grant those and be done with it. Those parties would all waive any further litigation. I can't speak for it all. So that ends it. Now, can you ever say there won't be other lawsuits? Can somebody sue and somebody this? But if you didn't file an appeal and you didn't get a license, how best to do it? And so my point is, don't take the risk, because a judge may well slam the gavel. And when a judge puts down the gavel and says, stop, we all stop.
We
And
have
the
a
only
couple
ones that
more.
get hurt are them.
We have a couple more questions for you too, okay? Representative Jaspers.
So I
Thank you,
give a
Madam
closing
Chair.
argument. I'm sorry.
Yeah, we got it. I appreciate the history. I think all of us in here are well aware of how this has evolved and all that's happened with it. But I just have 2 questions. Now, are you saying you don't like the bill?
No, I'm
Okay.
not.
Okay.
Let me make
good.
very, very clear. I'm
Great.
not. I did not know this was on today, but I immediately, when I got here, asked if I could talk to both of these guys tomorrow. I'm not going to say that at this point. I have no issues on the medical side, but that's something that you all work out, and I think we'd probably find agreement. I think the big problem or issue for me is just how do you resolve the legal?
Okay, so that's where I'm going. So in your opinion, so if this bill, we pass it, we work hard, goes through the whole process, the governor signs it, the worst that can happen is that it can be stalled in the court of law. The best that can happen, as these children that Chairman Cooper has described, will get their medicine.
Correct.
So there's no real issue about us moving this along.
No, to answer your question, I'm not sure. I would like to work on details because I obviously prefer our legal position on how to end where we are. But no, we definitely need, and the people need, and the patients need. I hope it's a work in progress, but I did not come here to defeat this bill.
Okay, thank you, Madam Chairman.
Representative Fry.
Thank you, Madam Chair. I appreciate you bringing all those issues up. And I just want to point out to the author and as well as you is that, I don't think if we change this legislation that we're trying to avoid lawsuits, I think we're getting back to what I was originally saying to you, Representative Gravely, we shouldn't even have a limit on the licenses. And then why are we even limiting the licenses in the first place, besides the Senate telling us that they're not going to pass anything? I think we need to get to the point where this isn't even a discussion. And it's not about being afraid of lawsuits. It's about getting back to where a lot of the body wanted us to be when we started this out. But I appreciate your information. I appreciate y'all bringing the bill. Chairman Cooper, I'm so tickled to death to see you sitting right there.
Yeah.
I got in
Competition
trouble.
never hurts unless it's an opponent.
That's
It's
exactly
that
right.
way.
She was my Valentine.
Thank you.
Um,
Dale Jackson.
Well, just, Madam Chair, before
Oh,
Mr.
yes, I'm
Jackson goes,
sorry.
just to say, I don't necessarily disagree. However, I've got to have something that can pass the Senate, that can come back and pass the House, and that the governor will sign at the end of the day. The Senate took us down. We passed 10 licenses. The Senate took us down to 1. We didn't get back up to 6 until conference committee. So a lot of times my wants and needs go out the window in order to get something to the forefront that will get patients medicine. But I do appreciate your comments.
Representative Fry.
Oh, just want to say, yeah, Representative Gravely wasn't indicating that you were the one that was blocking it. I did mention the Senate.
Okay, now let's try Mr. Jackson.
Thank you very much. My name is Dale Jackson. I have probably testified here, not in this committee, but at this grounds, probably more than any other person on this matter. Madam Chairwoman, I appreciate your sincerity with the children. I know most every bill that you've ever passed has something to do with children and the healthcare. And I know you're very genuine in that. And I thank you for coming full circle on our issue here. I don't know who all had a chance to hear my testimony Wednesday, but I was a little angry. I'm still angry, but honestly now I'm at a loss of words, because today I stand and I have to testify against cannabis legislation, and I thought this Capitol had gotten crazy enough. We've talked a lot today, and I've heard a lot of y'all use the term 7 years. We've been at this 7 years. I'm not going to repeat any of my testimony about how effective cannabis oil is, but I'm going to explain to you every single, well, not every single, because we would be here for 7 days, illegal activity I've had to do and what that looks like. Because I would dare say that none of you understand or even know legally how I can obtain oil, because legally I cannot. Anywhere in the country, nowhere. Colorado, nowhere. Okay, I have a minor son. Okay, so that means anywhere I go, even California, I can go buy a bag of weed myself, but I have to have a special license to give my son, a minor, has autism, oil. Colorado didn't even approve autism until 18 months ago. That was after we passed our law. Autism wasn't even on the list in Colorado. And those people are crazy. But what did I used to be able to do? Used to, when it was just fairly legal in Colorado and Oregon and California, but nobody really, they were so crazy. I used to go out there and I would buy it by the tens of thousands of dollars. And I would sneak it back here, sweating the whole entire way. And my wife, man, did she get upset with me. She was scared to death too. But that's what we had to do. I at least could do it. I could physically do that. Okay. If I chose to put my life in jeopardy, I could do it. I was scared to death a lot of times, but I could physically do that. You know what happens now? Micah, do you know what happens now when I try to go to Colorado, Nevada, Oregon? You know what they tell me? They're like, holy smokes, Dale, I'm sorry. The government is checking every single ounce that we're processing. There is no way I can put in jeopardy this $37 million facility just to sell you $5,000 worth of oil. Then I go into the next one. Then I go to the next one. Then I go to the next state. And then I go to the next state. And you know where I end up? I end up about a block and a half from here buying my son's medicine from a drug dealer. So that's what 7 years looks like to me. That's real, people, real. Real lives are affected with this. It's not a word you just say 7 years, because what I hear when you say that, just 7 years, I hear 3 more years. Because this legislation right here will be held up in court for a minimum of 2 to 3 years. I am honestly, I was hurt. I was angered last week for the other families, but I'm sorry for who and what is behind this legislation. I'm hurt. I am deeply hurt, because at the end of the day, what this all boils down to is this is 22 licenses versus 6. And I think a really good term was used earlier today. Earlier today, when I heard that comparison, you know what I heard used with it? Well, should we give out 22, but won't that devalue the 6? Devalue? Wait a minute. They've been coming up here testifying on my behalf saying, this is about the patients. This ain't about the money. I would like to know, because I know all of you 6. Most of you have come to me wanting my advice to help you get the license. So I'm asking you, the 6, most of you are right here. You know me. Are you going to sue? Are you going to sue and stop this entire industry? Tell me now. Look me in the eye and tell me that you're going to sue if we issue 22 licenses just so you have less competition, just so you can make more profit. You're going to sue. We got one way to make this work, and that is issue 22 licenses. We instantly remove all standing in the court of law of those 22 when you hand them a license. And to hear people cautious about adding licenses now, you weren't cautious, True Leave, Trivana, you weren't cautious. You were asking me to help lobby on your behalf. So I'm asking you, because I'm telling you right now, if you do sue, I'm going to let every parent know who is stopping them from getting their oil. And if you're a politician and you have given us lip service for the last 7 years and said that, oh, I'm behind you, I support you, but just, it takes time, Dale. It just takes time. 7 years is a long time. A lot of people have died in 7 years. Every single month, I have to get a new bottle of oil and give to my son who cannot communicate with me in any way. And so almost by the end of the month, I get his dosage close to right. What about the process that when my package did get confiscated? Because that's where this is going. See, and y'all don't know that, but in 2017, my package got confiscated. I was shipping it out to a lab in Oregon just to prove that the oil I was making for my son and probably a few hundred other people, that was safe, effective, didn't have any heavy metals or pesticides in it. UPS confiscated that package, handed it over to LaGrange PD. LaGrange PD gave it over to the GBI. You know what the GBI said? Do not make an arrest. They just confiscated extremely illegal material. When was the last time you saw a cop collect about 10 grand worth of cannabis, and the GBI says, hey, don't make an arrest, please. But they did. You know why? Because they don't want all the families that have been up here lobbying for this to show up in court and explain just how stupid and idiotic our law here in Georgia actually is. And so I'm just letting you know, there won't be 3 more years. I promise you that. If you pass this legislation and it winds up in court, I will wind up in court. And I'm going to start doing Facebook Live on every single illegal drug activity I do. And I'm going to force you to arrest me and every single family. And then I'm going to tell that jury exactly what I just told you. I'm going to tell them every single thing I do. And they're going to say not guilty. And you want precedent? Micah, you worried about precedent and lawsuits and giving out licenses? You waiting for a jury to say not guilty to me. I wanted to do that 3 years ago. But I got kids. Do you know what it's like to have to worry about the government coming and snatching up your kids? As a mom, I know y'all know what that's like. Us men are stupid. We don't really get it that clearly, but y'all get it. Guys, this is something that has to happen. The time for just saying, well, let's take the process slow. Let's just do this. It's over. This has to happen this year. The families are not taking it anymore. So I'm asking you again, this is all about a threat of a lawsuit. If you want to take what Ms. Cooper has put as far as MAG goes, and by the way, I serve on the board of Wellstar. I'm not a wacko. Okay, if you want to take MAG, I'm not here to debate that. You're the professional there, Ms. Cooper. That's not my game. That's not my circus or my monkeys, okay? This is all about 22 licenses or 6. This is about, are the 16 going to sue or are the 6 going to sue? And I'm asking you people, y'all are smart human beings. Use common sense. If all we care about is getting this industry off the market, off the ground, you got 22 potential licenses and 22 people wanting them. You have 6 licenses and 22 people wanting them. Why don't we give 22 out and then figure out who in the world would possibly sue? And if they are going to sue, I'll let you know about it. Everybody know about it. So it's 6 or 22. So right now, House Bill 1400 just left committee. Got voted out today. And the families of Georgia support House Bill 1400. The families of Georgia support moving the MAG over to 1400 if that's what we want to do. But just giving out 6 licenses and then waiting 3, 4, 5 years to issue one more, it's not good enough anymore. We've listened to your lies for 7 years. Now it's over. Pass House Bill 1400. Give out 22 licenses and let the patients of Georgia get some oil.
Representative Sharper, I believe Representative Sharper had a question. too
Yeah,
up here,
just
too.
brief. Well, it's not really a question, but anybody that knows me, I'm always about the people, the citizens, no matter what. And I always say, follow the money. So, you know, I see eye to eye on this and I understand that. So I'm not about what profits the companies are trying to make and them going against each other about getting position, if you will.
Mm-hmm.
So trust me, I feel you on what you're saying, and it makes a valid point on what you're saying. So I appreciate that. Now I have one quick question for the author of the bill. All right, and we're looking at talking about the dosages. The other doctor had a question, very legitimate, as in the dosages for the kids. I know if we're going through the composite of state board, and also I see where the pharmacy is involved. Can someone answer what is the plan for that? Just say you get the oil. And I know this people have to go to a doctor, of course, but how would that work? What's the accountability for the doctors to come up with some type of dosage per patient type thing?
The way the bill reads, right, Micah, is the doctors can suggest a dosage. Dr. Reduca was right. When this bill first started, it was 0.5%. 0.5. And somewhere in the process, one of the reasons that I fought so hard against it was it became 5%, not 0.5. One of my concerns was over the children with it. And I'm old enough to remember the 60s. And back in the 60s, people were getting high on 3 and 4. And so that was a concern with me. But the law allows the 5%. I got the law and I'm marking out low THC just because I can't stand seeing the low. There, it drives me crazy. But as far as going forward and changing it, the doctors can suggest, that's one of the reasons that they would see them every year and hopefully start a relationship with the families and be able to, you know, say maybe you better give 2 drops and not 4 drops, and, you know, work with families that, especially with children. I mean, down the road, if the legislature wanted to change it, that would be our prerogative. I would like, and yes, you know, I care about the children, and I didn't get your last name, Mr. Jackson, but I do want to say something about it. Since last night, I've had 3 calls about another bill. Years ago, one of the governors, you know, decided that he should call me the little legislator that tells it like it is. Well, I will love him forever because he said the little legislator. But I just don't know how to say anything without just being straight about it. And so I've had 3 calls over a bill that has to do with vaccines and the mandates. And they're very, and, you know, this is a new one and it's very wide and would go into children's, you know, getting vaccines for school. And I had to explain to the people from my district that call me that there are 2 chambers in this house and this legislature. And there's a bill over there put in by the rules chairman who carries a lot of weight on the Senate side. And it has been drastically changed on the mandates. He could barely get it out. It's gone down to where it's just, you know, that it's 1 year, it has a sunset and all other kinds of restrictions. And that's the problem. You know, I would like to see this bill move forward. You know, the other bill has moved forward and people above my pay grade. But the reality is we have to have a bill that will pass the Senate and that will be signed. And we don't control the Senate. And if they won't vote for wide open, it doesn't matter what we think. And that is why we presented this bill, because we think it's much more likely to have an opportunity to get passed by the Senate than the one where it upwards. They changed it, like Micah said last time, to 1. And in conference committee, we got it to 6, or they did. I wasn't at that point of being backing. So sometimes people don't understand the reality, and no matter how many of us might want it changed, that there are 2 chambers and the governor's office, and it has to go through both of them. And sometimes that's difficult, and compromise has to be found. And, you know, we thought that this was at least a compromise that we should put forward and see what happens. And I'm just telling it the truthful, the way it is.
Thank you, Madam Chair. Dale, I'll never question what you've done for your son. Ever. You've helped chart a path in a state. But I too have broken the law to get family members an illegal substance. I've had sheriff's deputies bring a grandmother to my grandfather's house next door at 11 o'clock at night, wandering the roads. I've met people in an AutoZone parking lot and handled them a substance that I could have gone to jail for. Just like you, Dale. 6 people were awarded a license and 16 lawsuits were threatened. What about them 16 people that didn't care if the kids got oil or care about your child? 16. That's what got chosen, 6, whether you like the process or not. They didn't break the law. Should they have hired somebody to grade it? Yes. But 16 people didn't give a damn about the kids in this state. We'll sue and we'll hold the process up. I'm just as pissed. 6 people could have been making oil right now. Could have already been on the shelves in the state of Georgia. 16 people said, oh, we'll sue. We're going to protest. We're going to hold that up. I got issues with that too.
Okay, let's all take a deep breath, okay? There's a lot of passion in this room, no doubt, no doubt. Everybody cares. And I think there is certainly great care and concern for the children and the families and the elderly and the people of all ages who need and hunger and thirst for this possibility. So our goal as legislators is to get there. Not sure how we get there yet, but we're all working on it. And that's what really and truly matters right now. I was privileged to be on the very first study committee about this. I understand the passion, understand the pain. I understand the passion, the pain. We're coming right back to you just a minute, and then we have another member. But just everybody take a deep breath and let's see if we can, let's see if we can finish. I'm not just talking to you, I'm talking about the whole room. I can see everybody.
Did you see me
Okay.
jump when he hit the table?
There's a lot of jumping going on in here. Yeah.
Yes.
So, yeah, let's go back. I don't think Representative Sharper was through with his comments. So let's go there.
Right. So my biggest points, like I said, is about the kids and whatever we do in regards to this bill, however it comes, if you got 6 or 22, whatever you come up with. My concern is making sure we have a safe dosage for that's for the kids and for the adults, something that's kind of what we need and not do this way, that way, or I want something consistent for the people. So that's my biggest concern right now. So just make sure this can do that. Okay. That's it.
Thank you, Madam Chair. Forgive my ignorance, but I've got a question as to why can't the 6 go ahead and proceed with their facilities while the lawsuits for the other 16 work their way through the courts?
There are some that are doing that. There are facilities currently being built right now, waiting for the approval to go ahead and start making the oil.
When y'all speak, we all need to pull the microphone
Yeah,
closer.
there of some of the awards are already ready to complete their facilities. They're just waiting to start production.
When you say waiting, they're waiting for the courts to approve
They're
it? What are they waiting
They're
for?
waiting for the protest period to be over.
And how long is that?
Could be 3 years. Yeah.
The commission's waiting to see how this bill versus 1400 is.
Okay, thank you. Thank you.
But they weren't issuing anything before these bills.
All right, we have one more person that signed up to speak, Dr. Kelly DeGraffery. If I messed it up, correct us, please.
No, you're fine. Thank you, Madam Chairwoman, and the distinguished members of this committee. My name is Kelly DeGraffenreid. I'm a pharmacist and family physician by training, and I'm here representing the Medical Association of Georgia as the chairperson for the Medical Cannabis Task Force. We speak on behalf of this bill because it seems to create the infrastructure that helps get us to that place where we have high quality and safety of both the product, the patient, and providers. We at MAG thoughtfully recognize that really medical treatment, and that's what we consider THC oil as a medical treatment, is ultimately at the decision between the doctor and the patient. And so we support these extra guardrails to help get us to the path where we have a high quality and patient safety included after House Bill 326 passed in 2019.
Thank you. Are there any comments or questions? Not seeing any. Oh, wait, there is one. Representative Jaspers.
Is Madam Chairman, at the appropriate time, I'd like a motion to do pass.
Okay, just a moment. Let me go back just to our presenters and make sure if they have anything else they'd like to say, and then I will come back and entertain that. Is there anything else that either of you?
I don't.
Okay, Chairman Jaspers for a motion.
Thank you, Madam Chairman. I'd like to make a motion do pass on the item before the committee.
Thank you. Representative Fry, you had your button pushed. Did you want to say? Representative Fry has an amendment.
I'd like to be recognized for an amendment. Madam Chair, thank you. I'd like to amend line 119 from 4 to 8 and amend line 130 from 8 to 16.
Is that on the number of things?
So that was 119 from 4 to 8
Is that
on
the
line
things?
119. And then on 130, it was from 8
to 16.
to 16.
No, right. I would like to object and ask that that amendment not be recognized.
Author of the bills have asked that that amendment not be recognized. Is there any further discussion on the amendment? I believe since we have an amendment, is there a motion? Not seeing any, the amendment dies. And we will go back to the motion and the second for due pass on House Bill 1453. Is there any further discussion? Not seeing any in the room or online. All in favor signify by saying aye.
Aye.
Aye. Those opposed by like sign. Not hearing or seeing any opposition, the motion carries and HB 1453 has passed.
I'd like to thank the members of the committee. And I want to say to the people that testified that I appreciate the testimony and understand, like the chairman said, the passion behind this. Hopefully, we will be able to get a bill over to the Senate that will win their approval and we can get started. As I said, I try to be very, and the people that wanted the mandate bill very differently had trouble understanding the process and how one chamber doesn't always get to decide what the other chamber will do. But I promise to work as hard as I can. Thank you.
Before everyone leaves, there are 2 more bills on the agenda.
It's
As
don't
soon
know.
as the chairman gets here and decides.
Okay. Robinson. Okay, I mean, the senators, you know, they make us come over there and present the bills. I'm not gonna give a messenger. I'm not into murder today after that last one, so. I'm telling you, did you see me jump? I must have gone up 3 or 4 inches when he did it. Okay, go ahead, you can present the bill. Tell the senator I will give him a pass this one time.
Okay.
Okay, and he needs to, you know.
Thank you, Madam Chair, and members of the committee. We're here with Senate Bill 116.
Pull the mic closer. Now, the problem
Thank
I
you.
had.
I'm sorry. We're here to present Senate Bill 116. This passed out of the Senate. This is doing something that has been needed to be done for quite some time. And this will be called Betsy's Law after this lady's little girl. And we'll ask her to tell the story that you'll so allow us to do. But this is relating to children and youth services, so as to provide for registration of maternity supportive housing residences, to provide housing for pregnant women, to define a term, to provide for requirements, to prohibit additional rules and regulations, to prohibit constraints imposed by local governments, to provide for statutory construction, to provide for related matters, and to appeal conflicting laws and other purposes. What happens a lot of times, young ladies become pregnant and they have nowhere to go. And at this time, if I'll turn the microphone over to you.
Thank you. My name is Elizabeth Reed. I'm with, sorry. My name is Elizabeth Reed. I'm with the Georgia Life Alliance. We support this bill, obviously, just because it's a great measure. It would help, you know, pregnant and new mothers who are facing homelessness. Personally, I support this bill and we've worked on it for the past couple of years. When I was 15, I faced an unplanned pregnancy and had a choice that a lot of women are faced with. And when I chose life, my mother, I got in the car after I made my choice. I got in the car and I looked at her and I said, Mama, I can't do it. I can't get an abortion. And she looked at me and said, okay, well, I'm going home. Where are you going? And so for the next couple of months, I didn't have anywhere to go. I did a lot of things I'm really not proud of. In order to have food, I had to steal it, or I had to sell things people shouldn't be able to buy to afford it. I spent a lot of every single day just with the thought, I don't know where my next meal is going to come from. I don't know where I'm going to sleep tonight. And the baby that was born, I placed her for adoption. She turned 16 this past October. That means it has been 16 years and this is still an issue. That's just not acceptable when we're a state who passes things like the heartbeat bill. We have to be here for these women who are facing these choices, and we have to fix the reasons why they make certain choices. Thank you.
Thank you for your testimony. I know it's hard, even after 16 years. If it's any comfort, I am sure that you brought immense pleasure to someone in the family where they could not have children. I know that doesn't take away the heartbreak. When I said, you know, I remember the 60s, I was young, but I remember the 60s. I also, when I was in college, there were Florence Crittington homes called Florence Crittington homes across this country. where young women could go and live and get prenatal care and get the food they needed to make sure that they were healthy and the babies were healthy. Somewhere along the line, and I don't know why, those all went away. Maybe it was because people were having so many abortions and not turning to them enough. And that was a real safety net for young women. They could go there, and I still, every Christmas, put an angel on the top of my tree that was made by I was a freshman in college, and one of my friends that I didn't know she was pregnant, but ended up in a Florence Crittington home and made that angel for me while she was there waiting for the baby to be born. So, you know, I understand the need. It's about time. I do have some questions, and I think I've gotten them settled, and I'd like to ask them first, because I was concerned that the bill says that it will only provide housing. I'm worried about food, a way to get to prenatal care, and all the things that are so important to make sure that the mother stays healthy and the baby gets here also healthy. So Representative Williams, or, you know, I need somebody to explain to me, if it just says housing, only housing in the bill, how are those residents, you know, going to feed themselves and, you know, and if they have children at the same time?
What they'll be able to do, they won't be able to provide, and I'm just picking up the bill. So I assume they won't be able to provide a lot of things, but they will provide a safe place for them to be and guidance to go get Medicare, Medicaid, to seek county health department. The main thing is we've got to get them off the street and got to get them to a safe place, first of all. But I think that in this type of home sharing and sharing information, that this other will follow. And I think when you start providing those other services, then you have to be licensed. And so many other things come into play, that this is just a safe haven for them to be, and a shelter. And then the other would follow, I think, Chair Lake Cooper.
And the opposition to having other regulations, if you could provide food and
I'm sure they would be providing food and those type things in that home. And this is for nonprofit agencies, churches and things like that. And I'm sure that once these get established and these get licensed, and as churches partner with them and other community resources partner with these homes, that they will start filling their needs. You know, this is a big elephant. We've got to take one bite at a time. And this is the first bite to get this on the road.
okay, because the bill says only housing specifically.
Could I?
Shirley, go ahead.
Now, so I think with that, when we get into the other things that it has to provide, that clarification is in there because a maternity supportive housing residence we are creating that definition in this bill because it's not the same as a maternity home, which is already defined in the OCGA. A maternity home, which many of you probably know, is they have to provide these other services like medical services, you know, psychiatric services, you know, all of those things that you mentioned. But and again, with this, the residents cannot provide those services. The nonprofit who runs the residence can, or can, you know, direct them to those things. The main goal here is this housing would only be for adult women. This is not for minors. So these are women over the age of 18 who, you know, really all they need is a safe place to go every day and know that they have somewhere to sleep. And because it's really hard to figure out the rest of your life when you're spending every minute just wondering how you're going to survive.
Right. However, if you will look on line 17, about what they, during the pregnancy and up to 18 months after childbirth, provided, however, that no services other than housing shall be provided. That is the law.
Right.
And it's very specific. I'm just concerned, Representative Williams. I would feel better if we amended it and they said provided.
Would it be better to maybe amend it to provided that no other services are required to be provided, but that they are permitted to? Because I think if we add, that they're required to, then we do tread in the territory of maternity homes.
I'm going to let the rest of the committee, and I'm hearing this bill because we're getting toward late, and and I want to get it perfected because I know that there is a need for this kind of housing. However, I'm just worried about the fact, and especially since you're saying that there's up to 6 pregnant women and their minor children. If they're desperate enough to need a safe place to go with children, I would say that they would not have, most likely would not have the means to feed those children adequately and to feed themselves. Irregardless of getting prenatal care or whatever. Is there anybody here with Mike Griffin, are you here or?
We do have actually the very first home that would open under this law, should it pass, the director of it is here to
Okay.
testify. So she
Well,
might.
come tell me what you're planning on doing. And then, okay, identify yourself.
Yes, my name is Beth Hathorn, and I'm the Executive Director of Whispering Hope Women's Resource and Pregnancy Center. So we serve pregnant women who are in need. And one of the big things that we do is connect them with resources. And one need that we see again and again and again is the need for housing. And in our state, because of the current rules and regulations surrounding maternity homes, they're geared for minors, and they are written for minors who choose to stay in the care of the state through age 21. So for our particular nonprofit, the women that we see who typically need housing are women who would fall in what you think of as college age. They're in that, say, 18 to 22 age range, early 20s. Many times they've never been in the care of the state. So if you think about, say, a 20-year-old.
Running out of time. I've got a dog probably
Okay.
that I have to pick up
Well,
like a child.
for us,
Or they'll put her out on the street.
Yes.
So
Our home will provide housing, but also the women who live there, our organization, and I know many organizations who will open these homes, who will have requirement that if you come to live in this home, there are certain requirements of you. One is that you will have a job. You will either be in school or work, something of that nature. We have many partners who are going to partner with us. So their food, their whatever, it will be taken care of. The
Okay,
issue we're
and-
wanting to do though is have the housing so that at least they're not having to worry about that. They can focus on finishing their education or adding to their job skills and working. And we've got people to partner with us to help with childcare and all sorts of things. So
Well, okay, that opens up a can of worms. We had this young lady say, that getting food was that. So you're going to turn away somebody with children that doesn't have a job, is pregnant, and is desperate for help.
she may not have a job when she comes to us. Part of what we do is connect her. We have employers in the area ready to hire. So.
Okay, and who's going to take care of the children? Because we have children. Do we
We-
not Representative Hutchinson, have rules regarding childcare?
We partner with many other organizations. There's, for one that we partner with all the time is Head Start. So there are organizations in the area that can help us.
And who gets those children and takes responsibility of getting them to Head Start or to school? If the mother's working.
Right. We have, well, she is responsible. The mom will be responsible. And so we also, in our home, particular home, the way our home will be designed is that we have house parents who will live there in their own separate quarters. So if the women need something, you know, they need to get to the hospital in the middle of the night, they're in labor, they can get them there. They also can help with those transportation issues.
Okay, and we're talking about like 6 pregnant women and children. You know, if everybody had a child, that would be, and they had 6 people, that would be like one child would be 12 people living in a home. If they have 2, we had 6 more, like 18, up to that many people in the home.
So
thank you.
the home, it's up to 6 pregnant women or 6 pregnant women, new moms and their minor children could live in the home. But they do still have to abide by all the local zoning laws. So if it's, you know, if it's a 2-bedroom home, obviously 12 people can't live there. So they still have to abide by the local zoning laws. So if there is a home that's, you know, could fit that many people, you know, that's fantastic. But we just put it up to 6 pregnant women and their minor children.
Because I think it's had
Some local zoning laws, for instance, Milledgeville, because it's a college town, they don't allow more than 2 people who are not of the same household to live in a house. So they couldn't even do it in Milledgeville in the city. This would have to be in the county. But this would be not a community housing such as the mental health homes. And we have a number of those in Milledgeville where the group homes. But this would not violate fire codes or anything like that. This is not setting up homeless shelters. This is not taking on anything other than what they can take. I mean, there was a lot of common sense involved in this.
sense is not the law. And we're passing law. And I just want to get it right. What we do with it. I mean, I know the intent is good. I am not against the intent, you know, but okay, I've got this place lit up here. Representative Sharper.
Nothing. Go ahead. Somebody else can go. I mean, I can just see that there's some things that need to be handled in that little area that you're talking about the no other services thing. Because if you're in a home pretty much and someone come in your business model, and like she said, if you come there and you don't have anything, but if you would kind of format it in a way that if they come there, they have a certain amount of time to be able to get a job, and you're going to have resources there. So that was the first thing I saw you say, that no services other than housing shall be provided. That basically says that's all can happen. And if they don't have anything else, you guys can't provide it for them. So what's really the point if you can't provide anything other than housing? So I think that need to be added, that you would also offer resources to ways to get assistance, where it be Head Start, may it be food stamps, whatever it is, you know. So don't limit yourself on this, because this is what this does, especially when you say shall. So there needs to be an amendment for sure, how we can get the wording done, but that's too limiting right there. That's not really, like I said, I'm about the people. This is not helping that person that she described, you know, as yourself. That doesn't do that, but I would like to see that done. That's just my comment there.
Okay, Representative Mathiak. Okay. Representative Fry.
Thank you, Madam Chair. Yeah, no, and addressing what you said, Representative Sharper, I think it's important to make sure that we're actually providing an opportunity for assistance to the folks. So a simple amendment would be to, room, board and transportation. But then I also heard that you wanted to clarify against an existing structure, which is what'd you call it? Other women's home, or what was it?
So there are already maternity homes.
Okay, maternity homes.
This would be a maternity supportive residence. And I think the intent of the sentence that no services other than housing shall be provided, what they're trying to say there. And this, like I mentioned, we've been working on it a couple of years. The intent of that sentence was that we're not trying to require or create a list of things that these nonprofits have to provide or offer. What we're trying to say there is that they're not required to provide services other than housing, but they are permitted to.
Madam
And
Chair,
that's the intent of the language there.
then would we remove the shall and say are required?
I think what I'm going to do is I'm going to hear people, and then we're going to send this back to the drawing board. We still have time to move this. We still have time to perfect this. Are you hearing me, Representative Williams?
Yes, ma'am.
And you can tell the senator, but, okay. Representative Hutchinson. Sure.
If you did that, when you say provided, however, that no services other than housing is required, you can say that.
Is
So
that
that-
what you wanted to, is that what the committee wants to do? I don't understand. I guess too, going back, why would you not want, the basics of life are housing and food and safety. Well, you've got the housing, but on that basic hierarchy, pyramid of life, food's really important, and then would be safety for your children. Why would you not want to provide food at least? And it wouldn't have to be that the same people that have the house. If you wrote it like that, it could be from a nonprofit or wherever you could get it, but that you'd have to provide at least basic nourishment and all. I don't understand what the problem is.
Just requiring them to do it, because then, if you say that they have to, they're required to provide food and things like that too. Not that they wouldn't want to, obviously, as Beth mentioned, they're going to want to provide these services. They're going to work with other nonprofits to provide them. But when you require them, they're going to be, I think the next logical step there, it's kind of, if you give a mouse a cookie, if you require them to provide food, then the next thing is, well, these are the nutritional requirements of the food. What kind of food are you allowed to offer? And
I don't believe that's true if we don't if we put a basic nutritional diet or something that's not, and that mouse needs a cookie sometimes when
Right.
it's for its survival.
well, and
And-
this is, I'm not against, obviously.
Okay,
but
it's really nice that, you want to look at what these people want to do. But when we pass state law, we have to look at what we're putting into law as far as what protects Georgia's citizens. And if we pass a law that leaves it open to just what this group wants and what that group wants, then we may be putting Georgians at risk, where people think that they're going to go and they don't have a job and they don't have any way to get money and they're not going to get it. They may not get what they need. It's not like, if it were up to me, I would say providing prenatal care would be necessary, but I can understand. But the basics of food, I really have trouble with that, but I don't.
Well, I can understand that, but while we're haggling over this and there are people on the street.
Well,
So, and we would be,
Representative Williams, there may be people on the street, but this is not, it needs to be taken care of and we need to get it
well,
right.
and that's what I'm saying. We can have that substitute, Madam Chair,
Right.
if you would like, that Representative Sharper.
No, I'm not voting on the bill today. I'm going to
Okay.
send it back. for
Thank you.
to Let everybody else speak, Representative Williams, and you can work it out and come to me and people, till we work this out. Okay?
Okay.
Okay, but we're going to hear it out. Okay. Representative Hutchinson.
Thank you, Madam Chair, and I completely agree with you. It also compounding what Mrs. Chair talked about is there's a line in here, 38. The department shall not have authority to implement rules and regulations. So what it sounds like you just want like your neighbor to let somebody stay in the guest room without.
Well, so it does have to be a nonprofit as defined in the statute, but actually that amendment or that line section came from DHS.
Oh, that's a different issue. I said, that's a different issue.
Jackie Tate with the Department of Human Services, and the bill came to us with that language already drafted. We did not request that. We requested clarification on what defined the maternity supportive housing.
Okay.
And it would not include what we currently have in the definition for maternity homes.
Right.
In the definition for a maternity home.
I would need to follow up with clarification on it, but we currently serve youth from through age 21, and we provide housing as well as some of the basic services that you guys just mentioned.
Can you ASAP get me those basic
Absolutely.
services? I mean, because even though you only serve up to 21 age, if you're pregnant, having enough food to eat and that kind is not that different from somebody, well, it could be if they were 12 or 13 and really young and needing extra supplement because they're barely old enough to have a baby. But you know, you got an 18 or 21-year-old, it's no different than a 22 or 24-year-old in needing what they need to make sure that they stay healthy, that we don't have another death of a mother in that we have a problem with, and that the baby gets here and it's not underweight and that it's healthy. And I mean, I think that's what we all want, is a place for these people to go, but we want healthy mothers and healthy babies.
Yes, thank
Okay.
you, Madam Chair. I just wanted to clarify that did not come from us.
Thank you. Okay, Representative Jasper.
Mrs. Chair.
Okay. Representative Dempsey.
Yes, thank you. I think I hear what y'all are saying and I really value it. I've really been working on the issue of homelessness over the last year and of the people who are on the street. And I think we're kind of sharing some of that want to do, but about how we get there is really hard. Once you have children in a space, dealing also with reporting and child abuse issues, and a lot of things come into play that are very unintended consequences. However, I have great respect for Senator Robertson as well as our member. But it came through the Senate. So there had to be some conversation that we're not exactly understanding right now. I know they're not taking up a lot of our bills till after crossover anyway. So we do have some time here. I'd like to hear from Senator Robertson when it's possible and really, really hear what the intent and what the reasoning is behind this and what we can do to try to help, I think, what is no doubt a need.
Is that the last? Okay. Representative is the last person. Okay, is there anybody on the list that wants to talk about this bill? Oh, I know we have an opposition, so I'm going to take that. Gabriel Carter.
With ACCG, who I signed up also with Mr. Carter. My comments relate to as you've heard often from ACCG, our concerns are about preemptions and local control. That's an issue that's obviously a big deal to counties and local governments in general. And so our concern is not about maternal housing. We're saying that there's not a need for this type of housing. There clearly is. Counties and cities are required as part of their periodic comprehensive planning to study the housing needs for all their citizens and come up with plans for that. So our concern is lines 41 to 44 of this bill, which is a preemption. It says that local governments have to treat these housing opportunities of up to 6 unrelated women and their minor children the same as any other single family zoned property in that jurisdiction. And so to take Representative Williams, Chairman Williams' comment about Milledgeville, if they have a current ordinance that says no more than 2 unrelated people, this bill would preempt that, right? And so, and I know you want to move along, Madam Chair, and so I will try to keep this short. But again, it's a concern about taking away the ability for local governments to work with their citizens about the appropriate mix of housing and number of unrelated people. In Milledgeville or in Athens, you know, the need for unrelated housing may be different than in a different jurisdiction. And what this bill would say is that up to 6 unrelated pregnant women and their minor children could live anywhere else that any single family housing is permitted. We think that's a decision best left to localities, as we generally do at ACCG. The only other comment I will make is that from a legal perspective, pregnant women are a protected class under the Federal Fair Housing Act, under the Georgia Fair Housing Act. And so if we have localities that are treating maternal housing less favorably than other single family housing, then they've got a problem. Then they've got a legal problem now. I don't think that's what we've heard today, but I want to just point that out, that there is protection in place. We fully support making sure there are housing options for pregnant women. There's no question about that. But again, we are concerned about the preemption that this bill would impose and believe that's a decision best left at the county and city level. And I'm happy to try to answer any questions. And thank you for the time.
I did. Representative Hutchinson.
Another thing that worries me, thank you, Madam Chair. Another thing that worries me about this is, what is the business model? Oh, not for you.
Okay, thank you.
What is the business model for these maternity care homes? Because even nonprofits need money to survive. And the way this is written, I would think they would be looking to the pregnant mother to, I heard them say that they have to have a job. What if you have a maternity care home and all of them are ordered to bed rest? So I think this sets up women to be victims. I'm not saying you, I'm just saying, I think some bad actors can come in and take advantage of it.
Okay, we're gonna. It's late. And does everybody that wanted to testify on this list, Beth? Oh, you've already done that from Whispering, Mike Griffin.
I would like to add something.
Are you from here?
Am I from?
From the metro area?
Yes,
So you could come back.
yes.
Okay. Paul Smith, are you from this area?
Yes, ma'am. If it are,
No, I need.
yes, ma'am.
We need to adjourn.
Yeah, I was going to suggest that we reserve our testimony.
Okay, thank you.
Yes.
Okay, and Beatrice? Yes. Are you from here too, so that you can come back and testify also again for it? I'm sorry to have to do this. I have somebody that I'll recognize for a motion, Representative Sharper.
Table this.
Okay, I have a motion to second it. Is there any more discussion from the members? Okay, then everybody in favor of tabling it, say aye. Anyone opposed? Thank you. We're coming through loud and clear. Anyway, anyone opposed to tabling it? Okay, the ayes have it. This doesn't mean that we are trying to kill the bill or that we're not for it, especially me, because like I say, I remember the Florence Critting homes and what a crucial service they provided.
Thank you, Madam
And
Chair,
right there.
members of the committee. We will work on this and come back. Thank you so
Okay,
much.
thank you.
Thank you.
And we are adjourned. No, I've got to go.